anybody's curious, that was policy F27 that just passed our supervisory union last week. It's coming to our school board in another month or two.
I will vote no.
And it can be in response to any disease, not just COVID. So any disease, it can be masks, vaccines, isolation, testing, distancing even. Yeah. So I was really, really glad that we were having this event tonight because we're right on point. And next we have a legislative candidate and parent, Elizabeth Brown from Waterbury. Thank you.
That would be House candidate next 2 years.
Yeah.
Run again.
Please.
It's a
yeah.
lot of fun to run. That doesn't mean that's not a trouble behind the scenes. All right. Thanks, Amy. Thanks, all. It's when Amy asked me to testify, it was hard to do a lot of this. I think for many of us, having to go down and to hear these stories is quite painful. And I know, and I'll get into this in a moment, for my family, reflecting on the time. It's pretty traumatic, and I thought we were through this until I started seeing what disagreements were around in the school board in terms of this policy that's upcoming, and I still have 2 children that are in school, and we have the data, we know better, and the fact that they're adopting these policies and this is happening now, we need to stop this.
Yes.
I have 2 children. Lockdown March 2020 happened when my son was in 6th grade and my daughter was in 2nd. Just before this, I started working with the school to get my son tested for learning disabilities. 9 months later, delayed due to COVID, he was diagnosed with dyslexia. It was imperative that he be in school receiving the support outlined in his IEP. However, because he was not vaccinated, if anyone in his class, on the bus, anyone he came in contact with, symptomatic or not, he'd be sent home for 2 weeks every single time he was around anyone, and he would have to test to come back. His vaccinated peers did not have to do this and could remain in school, putting the family in an impossible situation. Masking was mandatory. This is kind of funny. My son and his friends, they were in grade 7 in middle school, just sort of, playing with the teachers and the administration, but they figured out if they brought back popcorn to school, they could breathe. So all of a sudden, I was buying mass amounts of microwave popcorn because they could sit there and they would very slowly eat. And they were also very well hydrated. These are kids who never drank water, but between sipping their little straw and eating popcorn, they figured out they could breathe throughout the time. All you have to do is look at Vermont's education performance overlaid by Vermont's approaches to the pandemic versus other states. Our schools, our teachers became enforcers of health mitigations rather than teaching. It was more critical to enforce distancing and masking, both mitigants we now know don't work and cause more harm than good. The company I worked for at the time, TIAA, a global financial services organization, instituted a vaccine requirement for all employees. If you did not comply, you lost your job. We were required to upload our vaccine cards and were told they would check the lot numbers to validate. I have peers in other states whose jobs ultimately were protected by their state government and chose not to comply. They did not lose their jobs. But I lived in Vermont and did not have that protection. I watched colleagues get locked out, and I knew Vermont was not going to have my back. We were not in a position at that time for me to walk away from my career for 17 years. My husband had been furloughed during this time, and we were building a home. My family and the financial risk, it was too much, and at the last minute, I folded and vaccinated through coercive measures. Back to my son. This is hard to admit. I don't even think I admitted this to you, Amy, until I wrote this. My husband and I were adamant that our children would not be vaccinated for COVID. Despite my husband's opposition, I was so scared for my son's future, his education, to be clear, that I took him to be vaccinated. He's an intelligent young man, but was not and is still not in a position where he can miss large amounts of school time. I feared he'd be held back, or worse. No, he was not forced to vaccinate, but if he wanted a public education, that was what we were told. Our family was under the guidance of our primary care physician at the time, our naturopath. We weighed the pros and cons, and as the data continued to come in showing the vaccines did not work to prevent transmission of the virus, or worse, could cause harm, we were certain this was not the path for us. Yet, our workplace and our schools forced this on us. I have to live with the fact that that vaccine may cause harm to my son. We increasingly know and see that in young men, they are susceptible to cardiac issues from the vaccine. Vermont is the fastest shrinking state in the nation right now per capita. We desperately need working families to move here. There are measures being pressed in our schools, supervisory unions right now that codify the ability to implement these practices despite the evidence. I ask, where is this coming from? According to the CDC, 48% of children have not been vaccinated against COVID. 48%. Back in 2021, 40% of parents were against mask mandates. Social distancing, we know the 6-foot rule is made up. If we continue down this road, you might as well put up a sign at the Vermont border telling 40% of potential families to turn around. They're not welcome here. How is it that our state that is so adamant about body autonomy has no concerns forcing injections and masking by taking away worker, student, and citizenship? Take that number back, 40%. We want working families, 40% are not welcome in our state. We're not going to grow.